how can you tell the difference if it's sciatica or other back pain? So in general, with lower back pain, it tends to be more localized to the area where you're feeling it. Sometimes it will radiate down into other areas, but it tends to be more focused in that region. When it comes to sciatica, what you tend to find is the sciatic nerve will be radiating and intense, and it can often travel from your hips down your leg and even be like a shooting pain. And welcome back to another episode of Soul Wellness. Now, just a reminder that if this is your first time listening to the podcast, these episodes are deep dives into specific problems, but next week we'll be back with another amazing interview or a very general topic. So if there's anything that you want me to cover, please slide into my DMs and let me know, because we would love to add value for you. So these episodes are really deep dives into specific problems. So if they ever come up in your life or for anyone you care about, you can go back and search and find them and drill down into this specific issue. So today's topic is all about sciatica. It's such a buzzword. There's so much information on it, and I'm going to break it down in a way that's really easy to understand, and also to give you actionable tips you can try at home, or even things that you can ask for if you go and see a health professional to help you get on track if you're suffering from sciatica or if someone you care about is. Now, sciatica is all to do with the sciatic nerve. Now, the sciatic nerve runs from your glutes, down your hamstrings, the back of your calf, and your foot. It is a nerve and it supplies the muscles in that area. So often when this nerve is irritated, it can be impinged for a wide variety of reasons. We can develop pain that can radiate from our glutes, down our hamstrings and our legs, even to our heel. So as a podiatrist, sometimes I would see this in my patients if they'd come in with persistent heel pain that wasn't going away. And when I looked further into some of their issues, I could see that the problem was actually stemming from the sciatic nerve or sciatica, and it was presenting as pain in the heel, because that is how complex your body is. The problem is not always where you think it is or where you're feeling it the most. So when you think about sciatica, I want you to think, yes, it can be lower back pain, but there is a difference between lower back pain and sciatic symptoms as well. So sciatica in general, sometimes if you've had an injury to your hips or your lower back, it can be flared up. It can also be flared up just from something called piriformis. And when that is spasmed, when your piriformis is spasmed, so it can really aggravate that area, and it can affect your sciatic nerve right the way down to your foot. And the pain can be unbearable. Now, some people will explain these symptoms that came on all of a sudden. Possibly they stretched or they moved too far one way, they felt a bit of a pinch, and then all of a sudden they had this pain radiating down their hip and their leg. And it really can affect your sleep as well. And there's so many different causes. So let's look at the spinal causes, and that's looking at your spine in general. And some of these things can be due to spinal stenosis, which is where you get degenerative bone disorders, changes in the bones, and that can cause sciatica. But also you've got herniated or bulging discs, and that can happen over a period of time. Sometimes it's when we've been wearing, really high shoes or had bad posture, or we've had these like complicated problems been going on for most of our lives, and all of a sudden it can result in a slipped disc or a herniated disc, which can cause sciatica. And obviously there's things like, subdermal masses. We can get malignancies or epidural hematomas, which is where we've had an epidural and the hematoma or the, spasm in the blood blister can fill up and cause havoc with the sciatic nerve, or we can get an abscess there, which can happen as well. And some of the non-spinal causes are things like piriformis syndrome, which we just spoke about before, where you get the spasm of this piriformis muscle in your glutes. Pregnancy often really can trigger off sciatica, and also things like trauma. So trauma to our legs and our hips, injury, or even just lifting heavy weights where we can spasm and pull some of those muscles can cause issues as well. So how can you tell the difference if it's sciatica or other back pain? So this is just in general. So in general, with lower back pain, it tends to be more localized to the area where you're feeling it. Sometimes it will radiate down into other areas, but it tends to be more focused in that region. When it comes to sciatica, what you tend to find is the sciatic nerve will be radiating and intense, and it can often travel, as I mentioned before, from your hips down your leg and even be like a shooting pain. And that's one of the telltale signs, but it's not always. So sometimes you need imaging like CT scans, MRIs to look a bit deeper and have a look and see exactly what is causing the issue. But in general, some of the common causes of sciatica and what I tend to see the most is due to this muscle imbalance. So, piriformis syndrome, or where your glutes or your hamstrings have been super tight, the muscles have spasmed around that area and put pressure on that sciatic nerve. And often with slip discs or herniated discs, we tend to see this a lot. And sometimes it can be that you were just, moving along and stretched a little bit and overstretched some of the ligaments or tendons in that area. It flares it up, it causes inflammation, and that can put pressure on the nerve. So, now we've gone through like the differences between lower back pain and sciatica. Let's talk about some of the common causes. So, what I tend to see the most is usually if we've had a bit of a gait abnormality. So sometimes it might be the way you walk. You've walked like this for your whole life, and then all of a sudden, the muscles have had to work harder to support you. And then you get this muscle imbalance, and, ping, one day you bend down and you spasm that area and develop the pain. As can also happen, you can get a slip disc in that moment, and sometimes that can be something that builds up over time or it just happens sporadically. And other times it's obviously changes like pregnancy or injury that can trigger this off as well. So, what will most health professionals do when you go to them with these symptoms? So, depending on who you see, if you see a GP, usually they'll give you some anti inflammatories. They'll tell you maybe to go see a physio, have some massage, use some ice, and generally rest the area. That's the general advice you'll be given. If you go to more a musculoskeletal health professional or someone like a podiatrist or a physio who's very experienced in musculoskeletal pain, they will tend to look a little bit deeper into where your symptoms are, and they'll try and find a pathway. And what I mean by that is if you're experiencing pain locally in the hip area, they will palpate and feel the way round, like up and down your hamstrings, in your calf muscle. They will try and get a guide as to how the pain is radiating and moving so they can work out which muscles are involved. Now, that's the kind of thing you really want to look for. You want to find a little bit outside of where you're experiencing the pain to work out where the referral is coming from. Because I've seen so many situations, even with sciatica, where they've, like I said, they've come in with heel pain or plantar fasciitis. The heel pain is what's bothering them, but the problem is higher up in the sciatic region or more in the glutes and the piriformis area. I've also seen issues where it's upper back. So upper back's causing all these issues. It's so tight and complex, and then that's causing havoc lower down. So it's really important to see a musculoskeletal specialist that will help you identify exactly the root cause of where these issues are coming from and help you just really unpack that so you can have a plan on how to treat it properly. Because if you just have sciatica and you just focus on the area where you're feeling the discomfort or where you think it is, potentially the problem's going to go on a lot longer, and you'll also have other undiagnosed issues around it, which can potentially make things worse further down the track. So, is there anything you can do at home to manage or ease your pain? Now, absolutely. It depends on what stage it's in. Some people, if they've actually just had a huge muscle spasm, they've reached down, they've triggered it off, it's really painful, and they can't do a lot at home. My advice would be things like heat packs. Absolutely heat over ice because you want to relax the spasmed muscles around the area. Now, whilst ice can be great with injuries, what it also does is it vasoconstricts the area and it makes all the tissues around it much tighter and triggered. And what you want to do is the opposite. You want to relax that area. You want to relax those muscles. So I would definitely encourage heat packs, hot baths with Epsom salts to really help relax those muscles. You can definitely try some anti-inflammatories at home and any massage around that whole area. So whether it's your glutes, your upper back, your hamstring, and your calves. And you can even use massage rollers at home gently and safely. Of course, you don't want to overdo it. But in particular, when you've had like a spasm like that, you don't want to restrict it and not move because you will absolutely make it worse. So definitely see your health professional as soon as you can. But if you know that it's to do with your glutes and your piriformis and your hamstrings, then absolutely get in there and massage that area to really help settle that down and reduce the pain and discomfort that you're experiencing. And so I often find using even some magnesium at home can be really helpful to massage on the area. Definitely heat packs, as I mentioned, and also making sure that your ground is stable. And so what I mean by that is not walking around the house barefoot. That can be very triggering if you have a problem. What you want to do is find your most stable pair of shoes at home, whether it's a pair of sneakers or a pair of walkers. Wear those and actually walk around the house and keep yourself nice and stable and cushioned, which will help reduce a lot of the pressure and shock absorption as you're walking and relieve a lot of that discomfort. You can also try some gentle stretching. So I like to, if you're lying flat on the bed and bringing your knee up and over your body to really stretch into that piriformis area. Also, stretching out your hamstrings and your calf muscles, very, very important when dealing with sciatic pain. And if you have any insoles at home, it's also a great idea to try them too, because what insoles do is they help to align and support you. So if your feet are rolling in and that's contributing to some of the pain that you're experiencing with the sciatic nerve, that can help reduce some of that by aligning you better, reducing those stresses under the plantar fascia, the calf muscle, and even the hip to give you a little bit of discomfort. We asked a lot of our listeners some questions that they wanted to know about sciatica, and here are some of the other questions I got asked. Can it be prevented? Now, this is a big one, and my advice to you is going to be sciatica can always be prevented, but what you have to think of is your whole body needs to be in perfect alignment. So, in order to do that, if you work out, if you run, if you do weight training, you have to make sure that you are lengthening and stretching those muscles and obviously putting in the work to reduce the risk of developing sciatica. So, that is going for your 1 monthly massages, using a roller at home, using magnesium, having the warm baths, taking the time to stretch and condition your muscles. I cannot emphasize how important that is in preventative care, particularly with sciatica, because we know that most of these symptoms happen from spasm tight, shortened muscles. So if you can just focus on that and focus on lengthening, stretching, making sure your muscles are in prime condition, you're going to be much better off. And could it be a sign of something more going on? So, yes, absolutely, it can be. So, I would always encourage you, even if you're treating your sciatica, to see a GP and to make sure they've exhausted all options and had some imaging done just to rule out any other causes of sciatica. Like we mentioned, sometimes there can be malignancies or tumors or some spinal growths that could be contributing to this sciatica or nerve pain symptoms. So it's definitely wise to look into that and make sure you've cleared all of that if the pain is ongoing. But particularly what we tend to see the most is that it is more musculoskeletal and it can be prevented. And are heels really bad when you have sciatica? So this is a really interesting one. So sciatica in general, it can really trigger off heel pain. And what I have seen a lot in my experience is plantar fasciitis and heel pain that continues for far longer than it should because the main key part, which is the piriformis or the glutes, haven't been addressed. So when I used to treat a lot of plantar fasciitis and heel pain in the clinic, I would obviously for the first few weeks really focus on their gait, getting them wearing the right shoes, working on their feet, getting their joints more mobile, getting the muscles right. But then as we progress down the treatment plan, I will always look higher up the body. So I'll be looking, what is the spine doing? What are the hips doing? What are the glutes doing? So it was not abnormal for me to be needling or doing acupuncture in the glutes and the piriformis with any of my patients with heel pain. In fact, it was more given than not, because if you leave any trigger points in the hip area, you're potentially leaving them with this sciatic pain that's causing their heel pain. So I always like to rule it out, take it away, so that whilst I'm progressing them through their treatment plan, I'm making sure that I'm getting rid of any potential other causes of their heel pain to give them the best chance at recovery. So I think if you've been struggling with heel pain for a really long time, absolutely get your hips checked, get your glutes checked and have some treatment on that area, because I used to find, 8 times out of 10, if it was a persistent heel pain that was going on for months, if I focused on treating the glutes and the hamstrings and making sure that mobility up that whole side of the leg was working better, the heel pain would always reduce faster. So that's definitely something that I found to be really, really helpful. And let's talk about shoes. Now, some people, if they've had sciatica, they may be wearing high heels to work. They may be not really thinking about what they're wearing on their feet. So I really want to challenge you to think about, what is my 80-20 rule? So I always say to patients that 80% of the time wear supportive, stable shoes to align your body, and 20% of the time wear high heels and wear shoes that you love. it definitely is a combination of both. But if you're having issues with your lower back, either slip discs or you have persistent hip or leg pain or sciatica, you definitely want to minimize your high heels, particularly during the day. So you don't want to be wearing high heels to work, nothing more than about a 2 centimeter heel. And I would be going as flat as you can, even under that, like, just really stable, supportive shoes. It'll make the world of difference to your lower back issues and your progress that you make with healing your sciatica. Because the minute we're in high heels, we're putting so much stress and strain on our calf muscles, on our glutes, on our hips, and on our spinal system as well. So, if we've got any slip discs in particular, high heels will aggravate it and really increase in that degeneration. So, what I want you to think if you are wearing high heels every day to work is, how can I minimize that? How can I either take a pair of high heels, put them under my desk for those meetings when I really need it, but how can I focus on, my commute to work, when I'm walking around the office, when I'm going out to get lunch or coffee, making sure that I'm wearing stable flat shoes, because that will make such a difference to how your sciatica heals. And whilst we're talking about shoes, I really want to highlight the need for insoles as well. And so, some people, when they're not sure of what they need with insoles, what I want you to really think about is, how can I offload the pressure that's causing my problem right now? Because orthotics don't have to be long term and so specific to your problem. But if you've got a bit of an issue at the moment and you want to relieve some of those muscles or tension, just using something off the shelf can make all the difference in just taking the pressure off, giving you a chance to breathe, giving some of those muscles, the surrounding muscles, a chance to work and kick in and do a little bit more work than what the ones that are tight and triggered are doing. It just gives you a chance to breathe, relax, reset. And that's why I want you to think about orthotics and shoes when it comes to treating sciatica. And if you have had ongoing issues with sciatica, highly recommend monthly massages to focus on relieving those trigger points. It is really, really valuable. And if you haven't tried any dry needling, I want you to think about it. I want you to think about, I've done an episode on this as well about dry needling and acupuncture, but it is very effective in releasing tightness. So, in all the cases I have seen with sciatica, every single one of them will have triggered or spasm muscles. So, it's not something that you can just fix overnight. You need to work at it, but you need to make sure the right muscles are needled. So, when I used to do this a lot, the muscles in your glutes are very, very deep. You need to use deep needles. Often the ones we'd use are about 70 millimeters deep, that they'll go into the muscle fibers. And really what I noticed is, it's a process. So you might see someone once a week for a few weeks, then you might see them once every 2 weeks. And slowly as you go through, you'll be releasing different trigger points in that area that will help relieve a lot of tension and pain. And there's so many muscles around the hip. You've got your adductors, you've got your hamstrings that attach, you've got so many different muscle groups. And so it takes a lot of different times to get in there and relieve a lot of those trigger points that have been sitting there for a really long time. And what you usually find, as you start to relieve a lot of those points, things will get easier, but then you can manage it more at home. And that's where your rolling comes in. Getting your foam rollers and really positioning those trigger points or those knots on that area to relieve the tension, and then improving mobility through stretching, even doing Pilates and yoga. I think there is a lot to be said about Pilates and yoga in some of these intrinsic internal muscles that help to build a lot of our foundations. And particularly if we're not doing a lot of that work right now, what we tend to see is that the bigger muscle groups get worked really, really hard, and the smaller muscle groups, the more intrinsic muscles, aren't worked enough. And that muscle imbalance is what also can flare up a lot of these tightness and trigger points. So you really want to think of, like, how can I work on these smaller muscle groups to help set the foundations, give myself the strength and stability so I'm not getting these flare-ups at home as much as I was before. And I think if you just incorporate those few changes, you'll find even if you do suffer from sciatica regularly, it'll be much easier to manage. And I often find even sleeping, like having a support pillow between your legs, aligning you better, much like when you're pregnant and you need to have that support and stability. If you're suffering from sciatica, just doing it when you're sleeping can make a big difference as well. And I guess the other advice I want to leave you on as we recap is that There are so many health professionals out there that are really, really able to help you, from your GP who can help you with scans, anti-inflammatories, to your physio, to your podiatrist that can help you with muscular pain and alignment, even your remedial massage therapists, and footwear. So looking at changing that footwear, making sure you're stable, and making sure you continually work on yourself with an exercise regime, whether it's regular walking, some Pilates, some yoga to strengthen those areas, because the worst thing you can do is do nothing, and those muscles will tighten and spasm even further, leading to more debilitating pain. And I definitely don't want that for any of you. So if you're listening and you don't have a problem, I hope you've got some tips out of that. If you know someone struggling with sciatica, please share this with them. Hopefully they'll get something out of it. And if you have any topics that you'd love me to cover, please let me know. And I will see you next week for another episode of Soul Wellness. And you don't want to miss this one because we'll be interviewing another special guest. Thank you.